We also got to make sure that that we continue to expand community health centers. Again, appreciate the members of Congress here. Community health centers are a really effective use of taxpayers' money, in my judgment. They provide primary care and preventative care for people who need help with medicine. And it takes the pressure off the emergency rooms. The most expensive place to find health care is an emergency room. These community centers are being expanded all across America. They want to open up or expand 1,200 community health centers. That's on top of the 3,000 that exist. We want to see to it that 16 million Americans are taken care of in these community health centers. In other words, it's a safety net for people. I recognize people aren't covered by insurance. We'd like more people covered by insurance. Until they are covered by insurance, here's a way for people to get good, cost-effective health care. Cost-effective for them, and as importantly, cost-effective for the taxpayers. What we can't afford to have happen in America is for the federal government to decide to run it all. That will not work. America is on the leading edge of medicine for the whole world. We've got the best research and development. We've got great docs. We've got fantastic hospitals. The federal government cannot run the system as well as docs, professionals, administrators, and patients can. Another way to save money is to introduce information technology into the healthcare world. I mean, one of the amazing discrepancies in American society today is we're literally changing how medicine is delivered in incredibly positive ways. And yet, docs are still spending a lot of time writing things on paper. And sometimes it's hard to read their handwriting. And therefore, sometimes it's difficult to have the spread of accurate information so that doctors can make good decisions. The idea of making sure we use information technology starts with setting this goal. Within 10 years, we want most Americans to have electronic health care records. That means your records, and what you hear us talking about it here today. I'll try to give it my best shot. Your records are on, like in a digital form that can be transferred over the internet, so that if you happen to be traveling somewhere and you get in a wreck, a doctor or emergency physician in Texas can call up the information or ask for information or seek information not only off the card but to your home doctor's office. And they'll be able to know what's wrong with you or right with you, what has been wrong with you, and how to treat you. You can imagine what kind of system that'll do. It'll cut down the cost of paperwork. It'll also cut down on medical errors, which, like, if you're going to be a patient, that's something you really hope happens. Sometimes information gets lost. Sometimes people inadvertently prescribe the wrong drug because the information isn't correct. And so the fundamental question is, how do we use technology? How do we modernize healthcare? That's what we're here to talk about. How do we, do the same thing that is happening in other industries to healthcare? And we believe we can change how healthcare uses IT. And it starts with the federal government. Listen, the VA is doing a fabulous job with using information technology. This hospital is doing a fabulous job for using information technology, which we will talk about. And so one of the first things we're going to talk about is, what can the federal government do to help? Now, we hired a guy named David Brailer. David's right out here to my right. David's an expert on information technology and how it is applied to medicine and to health care.